Discover the hidden secret to reclaiming your morning vitality in just 60 seconds. What if I revealed that an overlooked anatomical gateway on your body could reignite the unyielding firmness and boundless energy of your youth? Banishing erectile challenges without resorting to pharmaceuticals, surgical interventions, or the discomfort of clinical consultations? Envision awakening tomorrow with that instinctive, robust response coursing through you as it once did in your prime. Fueled exclusively by your body's innate mechanisms, requiring no devices or artificial aids. This is not mere speculation. It is a targeted activation through a straightforward manual technique that revitalizes pathways diminished by time. Remain engaged for the ensuing minutes as I delineate this underappreciated activation zone that eludes most men and furnish a meticulous, step-by-step protocol to harness it this very evening, potentially yielding transformative enhancements in your self-assurance by dawn. I am Dr. James Edward Carter. As a board-certified urologist and expert in sexual health and performance, in this discourse, contemplate the prospect of arising invigorated, commanding, and fully empowered, eschewing dependence on inconsistent remedies or acquiescing to suboptimal states. By the conclusion of this presentation, you will possess mastery over the precise anatomical locus, the exacting methodology, and the ideal regimen for observable modifications. However, prior to procedural details, an examination of the underlying science is imperative to elucidate why this constitutes substantive intervention rather than unsubstantiated assertion. It represents your physiology reasserting its foundational architecture. The science behind why it works. The human body functions as a meticulously calibrated apparatus. For exemplary performance in the lower pelvic region, three fundamental systems must operate in precise concordance. The cerebral cortex dispatches signals of arousal, vascular conduits facilitate unimpeded and forceful blood perfusion, and the pelvic floor musculature activates promptly to uphold structural integrity. With advancing age, particularly beyond 50 or 60 years, these conduits deteriorate. Neural transmissions attenuate akin to corroded electrical conduits. Vascular elasticity diminishes comparable to conduits rigidified by prolonged environmental exposure, and pelvic musculature exhibits reduced reactivity. This degradation accounts for the attenuation of spontaneous morning erections, not as an irreparable defect, but as a configuration necessitating a deliberate recalibration. Stimulation of pressure points, anchored in millennia of traditional medicinal practices and corroborated by contemporary anatomical insights, administers immediate neural revitalization signals. Analogous to initiating an automotive battery recharge, it circumvents obstructed channels to invigorate vascular dilation, induce muscular relaxation, and synchronize systemic operations. Furthermore, it reinforces profound pelvic musculature for enduring stability. To expand upon this, consider the physiological cascade. Erectile dysfunction, ED, often stems from multifaceted etiologies, including vascular insufficiency, neurological impairments, or muscular atrophy. Research indicates that pelvic floor interventions, encompassing perineal stimulation, can ameliorate mild to moderate ED by enhancing neuromuscular coordination and vascular responsiveness. A seminal study involving 51 participants demonstrated that perineal exercises, augmented by biofeedback and electrical adjuncts, resulted in 47% achieving normalized erectile function, 24% exhibiting improvement, and only 12% remaining unresponsive. This underscores the potential of non-invasive modalities to address root causes rather than symptomatic palliation. Historically, such techniques trace origins to ancient Eastern traditions. In traditional Chinese medicine, perineal acupressure aligns with the Huiyin point. CV1, believed to regulate vital energy. Kui, flow through the conception vessel, thereby bolstering reproductive health. Similarly, Ayurvedic practices in India emphasize perineal manipulation to balance the Muladhara chakra, fostering grounding and vitality. Modern validation integrates these with evidence-based anatomy, revealing how perineal pressure influences the pudendal nerve, which innervates genital structures, promoting vasodilation and muscular tone. The magic spot, your perineum. Central to this approach is the perineum, the diminutive dermal expanse interposed between the scrotum and anus, denominated medically as the perineal region. Subjacent to this ostensibly modest area resides the prostate gland, an intricate lattice of neural and vascular elements that directly orchestrate erectile dynamics and sexual efficacy. External perineal massage imparts indirect prostatic stimulation, augments pelvic hemodynamics, and resuscitates quiescent neural pathways, all executed externally to ensure utmost comfort and security. Conceptualize it as a latent command center where circulatory conduits and neural transmissions intersect, possessing the capacity to reinstate those autonomous responses presumed irretrievable. Anatomically, the perineum encompasses the bulbospongiosus and ischiocavernosus muscles, pivotal for erectile maintenance. Chronic tension here can exacerbate ED by impeding blood inflow. Massage alleviates this, fostering relaxation and enhanced perfusion. Benefits extend to prostate health. Regular perineal engagement may mitigate prostatitis symptoms, such as pelvic discomfort or ejaculatory distress, by facilitating fluid expression and reducing glandular congestion. Limited investigations suggest that at-home prostatic massage devices yield symptomatic relief in benign prostatic hyperplasia, BPH, and chronic pelvic pain syndrome, CPPS, with participants reporting diminished lower urinary tract symptoms, LUTS. How to locate and perform the massage localization is straightforward. Assume a seated posture in a supportive chair or supine position with flexed knees and plantar surfaces grounded. Position the index and middle digits upon the pliable interspace between scrotum and anus. Apply gentle compression to detect a subtle induration beneath, like a resilient tissue stratum. This constitutes your perineum, superimposing the prostate and essential conduits. Initial mild sensitivity signals potential stagnation amenable to resolution. However, acute discomfort necessitates cessation and medical consultation. The protocol for this 60-second intervention is as follows. 1. Preparation. Attain a relaxed state in seclusion. Ensure manual hygiene. 2. Localization. Exert mild pressure with the aforementioned digits on the perineum. 3. Firm pressure application. Commence delicately, escalating to consistent yet non-nociceptive intensity, reminiscent of actuating a resistant doorbell. 4. Circular dynamics. Execute languid clockwise rotations for 30 seconds, succeeded by counterclockwise for an equivalent duration, preserving uniform pressure. 5. Respiratory integration. Inhale nasally over 4 counts, retain for 2, and exhale orally over 6 to potentiate relaxation and perfusion. Adherence to precision optimizes efficacy while mitigating unease. For enhanced comfort, incorporate a lubricant such as coconut oil to minimize friction and perform in a temperate environment to facilitate muscular yielding. Internal variations exist but are reserved for professional oversight. This external method prioritizes accessibility. Schedule and realistic expectations. Implement biannual sessions. Matutinal upon arousal to initiate circulatory activation, and vespertine to dissipate diurnal accumulations. Supplement with a pre-intimacy iteration, 15 to 20 minutes antecedent for acute hemodynamic augmentation. Constancy parallels habitual practices. Sporadic application yields negligible outcomes, whereas 2 to 4 weeks of diligent adherence engenders substantive advancements. Anticipated progression, informed by empirical data. Initial days. Perceptible warmth and nascent pelvic vitality, indicative of incipient vascular enhancement. First week. Augmented morning responses and sensorial acuity, correlating with neural reactivation. Weeks 2 to 3. Discernible elevations in firmness, persistence, and spontaneity, aligning with muscular fortification. Week 4 and beyond. Proximal comprehensive restitution for numerous individuals, accompanied by amplified assurance and holistic well-being. Individual variability persists. Protracted conditions may necessitate extended durations, whereas nascent issues resolve expeditiously. Case illustrations from clinical trials illustrate this. In one cohort, participants with psychogenic ED reported 70% improvement post-pelvic therapy, attributing gains to reduced anxiety and improved proprioception. Advanced tips to maximize results upon proficiency acquisition. Employ natural emollients like coconut derivatives for seamless application. Append Kegel contractions. Engage micturition interrupting musculature for 3 seconds, iterating 10-15 cycles to synergize pelvic reinforcement. Sustain hydration at minimum 8 vessels daily to bolster circulatory integrity. Integrate during warm immersion to amplify muscular pliancy and efficacy. Incorporate abdominal strokes to address ancillary tensions, as perineal health interlinks with core stability. Further, explore adjunctive modalities. Biofeedback devices can refine technique by providing real-time muscular feedback, though manual methods suffice for initiation. Crucial safety information. Prudence is paramount. Abstain if manifesting acute nociception, infectious processes, inflammatory states, integumentary breaches, or profound tenderness. Solicit urological counsel for prostatic hypertrophy, prostatitis, or analogous diagnoses. While often salutary, bespoke evaluation is essential. Confine to 60-second biannual intervals. Excess may provoke irritation. This adjunctive strategy supplements, not supplants, orthodox medical regimens. For grave ED, cardiovascular pathologies, diabetes mellitus, or concomitant ailments, collaborative medical management is indispensable. Contraindications encompass recent surgical interventions or hemorrhagic predispositions. Invariably prioritize professional guidance. The deeper science explained. The perineum harbors neural trajectories interfacing directly with penile, prostatic, and pelvic floor constituents. Stimulation elicits these, augmenting prostatic secretory output, critical for masculine functionality. Suboptimal perfusion engenders cellular detritus, accrual and constrictions. Periodic interventions dissipate this, reinstating salubrious flux. It indirectly bolsters pelvic musculature for superior governance. Emergent inquiries posit that prostatic massage alleviates ED manifestations via congestion abatement and inflammatory attenuation, albeit evidentiary breadth warrants expansion. Neuroendocrine facets are pertinent. Massage modulates cortisol, fostering parasympathetic dominance conducive to erectile facilitation. Comparative analyses with pharmacotherapies like PDE5 inhibitors reveal pelvic therapies as viable alternatives for those averse to medication with fewer systemic sequelae. Integrate with healthy habits. To potentiate outcomes, amalgamate with quotidian ambulation of 20-30 minutes to elevate systemic hemodynamics. Stress mitigation via profound respiration or meditative practices. Chronic tension vasoconstricts and impairs functionality. Nutritional fortification, incorporating antioxidant-laden provisions, or caffeinated elixirs as delineated in antecedent expositions to combat oxidative stressors. Holistic lifestyle adjustments, tobacco cessation, moderated ethanol intake, and weight optimization further ED amelioration. Your 30-day challenge initiate this evening. Pledge 60-second biannual engagements over 30 days. Week 1. Prioritize technical acclimatization and habitual ingraining. Week 2. Vigilantly monitor nuances, such as morning resurgence or sensorial amplification. Week 3. Uphold unwavering adherence. Substantial progress often manifests herein. Week 4. Objectively appraise advancements, juxtaposing current versus antecedent states, and perpetuate as routine. Frequently addressed inquiries. FAQ. Is this efficacious for all ED variants? Predominantly for vasculogenic or neurogenic origins. Organic etiologies may require multimodal approaches. Can partners assist? Affirmative, with consent and instruction, enhancing relational intimacy. What if no improvement ensues? Consult specialists. This may indicate underlying pathologies necessitating diagnostics. You need not capitulate to chronological diminutions in functionality. Your physiology harbors remarkable regenerative aptitude when appropriately prompted. This perineal massage constitutes a streamlined, efficacious, gratuitous modality, amalgamating venerable erudition with contemporary physiological comprehension. This evening, allocate those 60 seconds. Reiterate tomorrow. Should this prove illuminating, endorse the presentation to disseminate awareness, subscribe and activate notifications for supplementary pragmatic insights. Contribute below. Have you engaged pelvic methodologies? Undertake the challenge and revisit in 30 days to recount outcomes. Your narrative may catalyze transformation for peers. Intimate wellness underpins comprehensive vitality. Anticipate our forthcoming dialogue on additional senescence countering tactics. Maintain fortitude and empowerment.